Let's look at a successful out-of-hospital care model example. Heart failure accounts for 2% of the overall NHS budget and 1 million bed days per annum. The average length of stay is 12 days, with an approximate cost of £3,976 per episode. With this in mind, the British Heart Foundation funded a pilot study to implement and evaluate an IV diuretic community programme over a 2-year period. The results of the pilot demonstrated that 79% of interventions resulted in an avoidance of a hospital admission. The average length of intervention was 7 days, with 869 bed days saved. With the average cost of each intervention around £420, this provided net savings of slightly under £200,000 over the pilot period, and with 100% of patients and 93% of carers preferring home-based treatment to hospital admissions, the programme demonstrated key benefits for both hospital trusts and patients. Let's meet David. David is a 59-year-old who underwent a total knee replacement 6 months previously. He presented at his orthopaedic outpatient clinic appointment with increased pain, swelling, warmth, and redness around the joint. He was admitted to hospital with a suspected deep prosthetic joint infection. After confirmation of diagnosis, David went to theatre for the first phase of a 2-stage revision. Post-surgery, he had a PICC line inserted for administration of his IV antibiotics. If the hospital did not operate an OPAT service or had limited capacity, David would have remained in hospital for 6 weeks to receive his required course of IV antibiotics. Instead, post-surgery, he was referred to the Trust OPAT team and assessed as a suitable candidate for self-administration OPAT, SOPAT, with delivery of his IV antibiotics by an infuser at home. The OPAT team educated both David and his wife on self-administering his IV antibiotics, along with care and maintenance of the PICC line and infuser. David was then discharged home after 5 days. An OPAT nurse visited David the day following his discharge, then on scheduled visits over the following weeks. During this period, David also attended fortnightly reviews with his orthopaedic consultant at the hospital outpatient clinic. David's feedback on SOPAT was that whilst initially he and his wife were a bit nervous about managing it, they soon became confident and felt supported by the OPAT team. He felt more comfortable receiving his treatment at home, and he benefited from not having to wait in for the OPAT nurse. This was particularly important when he was more mobile in the latter weeks. He could plan his day more easily and have more control over his time. He was able to continue working from home, and friends and family were able to visit more easily, making the whole treatment process more comfortable and manageable. Delivering out-of-hospital services requires integrated care models, where a variety of providers work in partnership to deliver a seamless service with benefits to both the patient and the health service. With the government committed to investing in out-of-hospital care models, now is the time to drive those conversations to develop or expand integrated care services where capacity is limited. Contact us to see how Vygon can partner with you in the acute to community journey.